Welcome back. We are talking about men and their dental health, good or bad. We're going to find out. Dr. Preety Desai is joining us now, laser implant specialist. Great to have you back.
Thank you so much.
Yes, and it's interesting to note that men sometimes do not take care of their teeth as well as women do. Is that the case?
That's absolutely right.
Okay.
Yeah, they just tend not to take care of themselves as far as their own health and oral health as well.
Okay, so they forget to do their 6-month appointment, or is it more than that?
It's more than that. They have a little bit of a backup plan as far as having higher testosterone levels as well, and that also affects your oral health in many different ways. Yeah.
What other things do you notice? I mean, you see people coming in for their checkups. What do you notice that men do? They floss less? What other things?
Yeah, they tend not to take care of themselves on a daily basis, so flossing, brushing, etc. They tend not to come in for their regular 6 months, and I'm generalizing, of course. And they also are a little bit more afraid sometimes. It's that macho image of, you know, I can handle it, but when they get in the dental chair, it's really, really stressful for them.
Is that right?
Yeah, yeah.
Also, some interesting news you might want to take note of as well. There's a connection between bad dental health in men and impotency. That's kind of a big deal. What's that all about?
Yeah, what periodontal disease does is increases the inflammation in the body. Part of that is the ducting and the piping in the body, all the vasculature. And as we know in our private lives, blood vessels have a lot to do with inflammation. And there's a higher rate of impotency if you're under 30 or over 70.
Okay,
Yeah.
Good to know. Any other little facts or tidbits? This is interesting info.
Yeah, higher risks of cancer associated with gum disease, which we've talked about in the past.
Right.
But certain types of cancer, such as kidney cancer, blood cancers are higher, as well as pancreatic cancer. And prostate disease, of course, men are, have a prostate gland, and more inflammation and more pain associated with that. And the last thing is that with the testosterone levels that are higher, there are different types of gum disease without going into too much detail, but they get more of the more serious gum disease because of their hormones.
I hear, and you're the expert, so you have to tell me, that flossing alone can absolutely reduce your chances of certain illnesses. The plaque that could be absorbed into your bloodstream has a really negative effect on your health.
Exactly, exactly. So, I mean, if you don't have time to do one or the other, flossing is actually equally important to brushing. Equally. So if you have to choose one, it's okay. One brush, one floss, but not on a regular basis. You got to do both.
Fantastic. Anything else you'd like to pass along today?
Yeah, if there's a man in your life, a father, a son, a brother, or a husband, often it is a spouse or a family member that will encourage their men in their lives to seek attention, take care of themselves. So, you know, it's not the sexiest gifts, but make a dental appointment for them.
Absolutely. And Father's Day is coming up, right? The gift of health. Go and get your teeth checked and start flossing and all those other things.
Exactly.
Thank you for being here today.
Pleasure. Thank you.
All right. You're very welcome. Information on the screen if you would like to make an appointment. In fact, kamloopsperiodontists.com as well, the phone number. We are back in 2 minutes. Stay with us.